My name's Anil Gehi. I'm a cardiac electrophysiologist. So I take care of patients that have heart rhythm disorders of all varieties. So there might be patients with slow heart rhythms that need pacemakers, or patients who are at risk for malignant fast heart rhythms that might need various medications or even an implanted defibrillator. And then I also take care of a variety of other rhythm disorders with medications or ablations. I really like to involve my patients in their care, and so I do a lot of teaching of my patients to explain what they have, what the consequences are, what the possible treatments are, and just kind of guide them through the different options. I think the most rewarding part of my job is being able to see a patient all the way through their condition. So I see some patients right at the beginning when they first start to have a rhythm problem and be able to, basically fix them. But then there are other patients who have a rhythm disorder that's going to be with them for their life, and I get to kind of help walk them through that process over 15 years that I've been here. I have patients that I've taken care of ever since I've started, and it's very rewarding to be able to kind of see them through that journey. I oversee our fellowship program in electrophysiology, so I'm very heavily involved in training our future electrophysiologists. I also am involved with the residency and medical school teaching. And then I have a lot of research interests. Primarily, my research is in the topic of atrial fibrillation, which is the most common rhythm disorder. And I'm really interested in how we can improve our system of care for patients, in the community. So we've been looking at ways of, for example, keeping patients out of the emergency room, ways to teach providers in the community who take care of AFib how to do that better. I actually have a lot of hobbies. Certainly, I spend a lot of time with my family, my wife and 2 teenage boys, so that's a lot of fun. It keeps me pretty occupied. I enjoy soccer, and I play actually in an adult soccer league. But probably my main hobby is music. So I've been having various musical outlets ever since I was in high school. Right now, that's down actually a couple of different paths. One is singing. So I'm in a choir. It's called the North Carolina Master Chorale. So we perform with the North Carolina Symphony. So anytime there's a big choral work that the symphony's doing, they call on our chorale to be the the chorus for the program. So that's a lot of fun. Actually, within our hospital, a few of us got together during COVID and put a band together. So we've got this band that, plays some house parties, and we like to get together and just play music. You may not be able to tell from my accent, but I actually grew up in a small town in Alabama. So small town, my parents, just when they moved to the US from India, they ended up settling in a small town in Alabama. And so I grew up in a town of about 30,000 people. And my mother is still there, and I go back and visit. And so I really enjoy living in the South. And I've become a lifelong Alabama football fan because of that. Still cheer for the Tar Heels, though.